Today we're doing one day of a week-long course called Introduction to Being a Physician. Many medical schools do not include a course such as this, which is unfortunate because the course itself is about learning as a physician, not just the bookwork, but the people, how to relate, how to listen, how to understand, how to be better.
It's an incredible experience because it allows us as providers, educators, and advocate about this disease to give our introduction to these young and early medical students about the disease, and more importantly, it gives the patient a voice.
It was 6 when I learned, and I had to take medicine because that's when I really learned I had to take medicine. Before 6, I had to really just be in the hospital, never knew what was going on. My mom kept it from me, being protective and everything. So at 6 years old, I was okay with having to take medicine and learn how to do it. It was terrible, disgusting. From that, I had to learn, okay, not just taking medicine, but remembering how to and why I need to.
Remembering how to take care of patients when you're taking care of patients is so much better than remembering page 6, which you can look up if you've forgotten.
Our child ended up being born about a month early. Had to stay in the NICU for a couple weeks, and a couple days before we left out of the NICU, a doctor came to us and took us to a side room. You know, being new parents, we're like, okay, what is this all about? And the doctor explained to us that our child had a condition, a disease called sickle cell disease. Me being a young mother, my husband being a young father, we kind of didn't know what it was, so we were like, okay, what does this mean? They went on to elaborate and tell us everything about sickle cell, like a 30-second, this is what sickle cell disease is. So naturally as a mom, I'm bawling my eyes out, like, what does this mean? Is this a death sentence over my child's life? Like, I just felt like, oh, like why our child? We were greeted by wonderful people from the Children's Sickle Cell Foundation that basically took us under their arm and walked us through the whole steps of what it looks like at the beginning stages. She kind of reassured us that, you know, your child can live with sickle cell disease. She said that she had 2 children that had sickle cell disease. Okay, there is some hope there. So that's kind of how we got initiated.
Children's Sickle Cell Foundation is a foundation here in Pittsburgh that originated through a mother who had a child born with sickle cell disease, and she couldn't find support, and she created her own. And since that time, it has grown into a much bigger organization than anyone would have known, but she may have dreamed about. We have worked with them for decades, and they are a collaboration that is, bar none, incredibly important to the families, to the hospital, to us as physicians.
As physicians, if you run into an illness or a disease or a virus or whatever that you are not familiar with, educate yourself. Educate yourself. That is what you need to do. And if your team or your colleague is not doing it, do it yourself and say, hey guys, this is what I found out. Like, her son may not still be breathing because of this. Her pain still might be here because of this. You know, you just don't say, we don't do that here, and move on, or say he looks fine and move on. Your job as a physician is to stabilize and treat your patient. You can't just rely on hospital policies. I mean, don't get sued, but you can't rely on everything that comes at face value. You have to, when something doesn't feel right, just dig a little deeper.
The patient voice and the patient experience in their own voice, I think, give a different perspective of what is to have this disease and what I would like you to learn from me, and also what I would like you to take care of me.
She reaches out and tries her very best, and is an amazing speaker, to teach the students what matters in their caring for patients with sickle cell disease.